Hello everyone. Today's topic is cataract, which is most common condition in ophthalmology. So, what is cataract? You should know what is cataract. Exactly, you can see this is a lens. In front of that is a cornea. Cornea is also transparent. Lens is also transparent. So the light rays will be focused on the retina. But if the lens, which is transparent, if it becomes opaque or non-transparent, then the light rays will not be able to focus on the retina. So the vision will be reduced. Now, exactly what happens in case of cataract? In case of cataract, basically the lens is made up of proteins and water. So the proteins which are normally soluble, in case of cataract, the soluble proteins are changed into insoluble, which can lead to cataract. What are the causes of cataract? One cause is congenital cataract also is there. Second is acquired. In case of congenital cataract, why it happens? In case of congenital cataract, usually it is a nutritional, genetic, and sometimes the blood supply to the fetus is reduced. For example, placenta previa. In that case also, the blood supply to the fetus is reduced and it can lead to cataract. And acquired condition is traumatic cataract. Maybe there's injury, maybe it is a blunt injury or a sharp perforating injury. And diabetes also in young age, if the patient has got cataract. And nutritional vitamin A deficiency, calcium deficiency. Sorry, parathyroid condition also can lead to cataract. And especially in India, we have seen now the cataract is, patients are getting cataract at very young age. See, after 40 years, people are getting cataract. Why? Because lots of pollution, and because of that, ozone layer is reduced. And because of that, the UV light directly falls on the Earth planet. And because of that, there is a cataract and there is a retinal changes also, macular degeneration. And acquired condition, if you take oral steroid for a long time, also can lead to cataract. And certain medical drugs also can lead to cataract. Symptoms of cataract. Initially, the patient may have glare or halos of the light, double vision, about reduced vision in the night. That depends upon what type of cataract it is. The colors are also little less, not very sharp. And depends upon the change of refractive error. Either the patient gets reduced vision for distance or not. So these are the cataract, and only by examination we come to know what type of cataract it is, whether it is a nuclear cataract or a cortical cataract. Nuclear cataract is usually central cataract. So in that case, usually in the sunlight, the patient gets less vision. And in case of cortical cataract, evening vision is reduced. So there are types of cortical and nuclear cataract. And posterior subcapsular cataract, where only the capsule is affected, but definitely vision is reduced. Complications of cataract, if cataract remains in the eye for a long time, whatever cataract is there, that convexity is increased and it can lead to glaucoma. Sometimes the fluid of the lens also comes out, lead to glaucoma. So types of glaucoma may be there because of cataract. How to manage cataract? If it is early stage, there is a change of refractive error. Patient can get glasses if there is a vision increase with the glasses. Patient can wear glasses for some time and follow up every 6 months. And if you feel the patient vision is less and it's difficult for daily activities, then surgery is the answer. In case of surgery, also there are a lens implant we have to put, so the patient starts getting good vision and very safe surgery. So in early stage of cataract, if you want to postpone your maturity, of course, there are various pathies like homeopathy uh, and naturopathy you can try. And if the cause is known, definitely homeopathy will be helpful. Yes, we have already spoken. This is genetic and causes of cataract, trauma, traumatic, age-related, diabetic, hormonal.
I'm trying to open the video, but it says unable to start the video. Okay, so we are talking about homeopathic kind of approach strategies in cataract. So first of all, we should know what is the type of cataracts, as Dr. Pushpa has already shared with you different types of cataract. We also have to understand the age group of cataract. Is it a senile related cataract? Is it in young people? Is it in middle-aged people? And we also need to understand the other kind of associated symptoms with it. So these are all the different aspects that we need to know. And finally, the symptoms. How much of the symptoms, how much of the visual acuity is affected, and all the symptoms are affected with relation to the vision. Based on that, we can practically take a call of starting the homeopathic treatment, and in many cases also avoid the surgery, and in many cases delay the surgery. And there is a remarkable homeopathic kind of approach available in treating cataract. You know that the great Phatak himself, you know, he was he was almost blind, and even with that, he would treat cases. He would give the Phatak repertory to the patients to check the rubrics and prescribe. So yeah. So this is a very interesting map that we have created. So if it's an age-related kind of cataract, definitely remedies like Calcarea floricum, a small remedy called as naphthalinum, conium, carboanimalis, very important remedy, cineraria, these are all important remedies. If it's diabetes-related cataract, again, insulinum, cortisone, these are all sarcodes. in hormone associated, when there are certain hormonal pathologies in women, middle-aged women, climacteric women, early cataract, other hormonal issues. Think about sepia, think about magnesium carbonicum. Traumatic cataract. Remember a remedy, Seneca. And finally, we need to, of course, study the genetic background, the miasmatic background. There is a very interesting remedy, zincum iode. It's a lesser known remedy, and of course, the great anti-miasmatics that we have. So one needs to really study the case in depth, understand patterns associated with the problems, and based on that, prescribe the homeopathic remedy. And I believe that in a very integrated way, homeopathy is a very important modality in treating cataract. One has to understand, like I spoke to you about that, which type of cases we are treating. And based on that, we should have the kind of plan of what we are expecting in the follow-up also. So a great homeopath from London, Master Burnett, he has written a nice booklet on cataract, and he has shown the way to all the homeopaths of the next generation how cataract can be cured. So make best benefits of it, and take help of a really good homeopath in taking the healing opportunities for cataract. Of course, you can join us. We have a homeopathic center here in Mumbai. You can come in person here, or we also offer online appointments. You have all the details here, the email ID, the contact details, and welcome. Thank you and namaste.